Bismillahirrahmanirrahim. Assalamu alaikum. So we have completed the gynae section. Now we will have to start the USMLE S2CK surgery section. So this is the vignette number first, which said that 22-year-old man is brought to the emergency department after a high-speed motor vehicle collision. Blood pressure is 102 by 60, pulse is 122, and respiration are 40 per minute. Pulse oximetry is 88% on 6 liter oxygen. The patient is alert but appear to be in respiratory distress. Breath sound are diminished bilaterally and bilateral chest tube are placed. The patient respiratory status initially improves, however, over the next hour he developed respiratory failure requiring intubation and mechanical ventilation. Post-intubation X-ray is shown below. So this is post-extubation X-ray which is shown here. So which of the following is the most likely cause of this patient need for mechanical ventilation? So this patient is 22-year-old woman. He was brought to the emergency department after a high-speed motor vehicle collision. His BP was 102 by 60 mm of Hg, pulse is 122 per minute and respiratory rate 14 per minute. Pulse oximetry is 88% with 6 liter oxygen. Patient is in respiratory distress. Breath sound on auscultation is diminished bilaterally. Bilateral chest tube are placed. He slowly developed respiratory failure. Most likely cause of this patient need for mechanical ventilation. So based on these hand and based on the X-ray shown here, this patient is most probably suffering from Flail chest. As we already know that her ribs are broken. He having bilateral chest intubation because the tubes are placed here, and the bilateral chest ribs are fractured here. So here the correct option is choice E, Flail chest. I will explain this how the Flail chest look like. So this is in here. This is a normal. This is the Flail chest, and here is the nasogastric tube. NG tube placed here. The another is the chest tube, and here is the rib fracture. On the right side here is also 3 rib fracture, and on the left side there is a 4 fracture rib. So we will come again to the question and explain that what is a Flail chest. So Flail chest, this patient has Flail chest which occur when fracture of more than or equal to 3 adjacent ribs and more than or equal to 3 location create an isolated chest wall segment that move paradoxically to the remaining rib cage during expiration. Other reason Flail chest may cause lung injury as seen in this patient. For example, contusion which may lead to respiratory failure. Flail chest cause decreased tidal volume and decreased oxygen saturation. So patient will try hard to breathe, and at last patient diaphragm and respiratory muscle will fade off and patient may go to respiratory failure. Come to the incorrect one, acute respiratory distress syndrome. So patient having acute respiratory distress syndrome, her system, the acute respiratory distress syndrome will take for example 6 to 72 hours to evolve after the inciting event, while the patient inflammatory response builds and causes diffuse bilateral infiltrate on chest X-ray. Choice B, blunt cardiac injury. So blunt cardiac injury can cause myocardial infarction, dysfunction leading to cardiogenic pulmonary edema and hypoxia. Choice D, diaphragmatic rupture. So patient having diaphragmatic rupture on X-ray, there will be visualization of the abdominal contents and the lungs. Choice D, fat embolism. So fat embolism most likely occur from the long bone fracture or pelvic bone fracture. Choice F, tension pneumothorax. So as we already know that this patient having the functional chest tube. So here the tension pneumothorax is not the diagnosis of this question. And if this patient is suffering from the tension pneumothorax, then there will be no lungs marking in the chest X-ray of this patient.